Uh-oh, guess what day it is? Guess what day it is? Huh? Mike, what day is it, Mike?
Hello, I'm Michael Andrew Weston, and welcome back to Hump Day Health Talk. Today, I am so excited, and I mean that in the most sincere way. I'm excited because I have our resident fashion queen here with me, but also someone who is highly skilled in a range of practices. But specifically, I'm excited to talk to Francisca Onunaku, or Frankie, as we say. We say Frankie, one of our providers here at Caroline's. I'm really excited to talk to you because we're talking about a few things in Mental Health Awareness Month, but one of the things that often gets overlooked is substance use and the connection to mental health. And in just a minute, I'm going to ask you to talk about that, but we're also going to touch on something known as MAT. I'm going to let Frankie talk a little bit more about that because, Frankie's the expert after all. But first of all, let's talk about how substance use ties into Mental Health Awareness Month and just mental health at large.
Thank you, Mike. First of all, I'm going to describe what substance use disorder is or means. Substance use disorder, according to DSM-5, is described as a chronic disease that affects different parts of our brain, mostly prefrontal cortex, where our decision-making, planning, action, and it also affects our basal ganglia, where our reward comes from, and also amygdala, where our anxiety comes from. And thank God for what we call MAT. MAT is medication-assisted treatment or medication-assisted therapy. Medication-assisted therapy is combination of medicine, therapy, and group like AAA meetings. You cannot do just medication to get the person where they want to be or where they should belong to function in the society.
We gotta say that one more time. You cannot just do medication.
Yes.
It has to be medication and the therapy
Behavior therapy and group.
and groups.
Yeah, meetings. They have to be attending the meeting. They are different. I'm not gonna go into types of therapy that we have, but the most popular one is what we call CBT, cognitive behavior therapy. Cognitive behavior therapy will change that negative thoughts, their behavior into, we use some kind of Socratic question to get them out of that negative thoughts and move them into positive behavior, which can help them live better, because when they live better, the society will live better too. So in MAT, we have different types of medication. We have, initially, it used to be only methadone. And methadone, they have to go to the clinic to get that methadone because it's a controlled substance. Now we have more variety of medication, which include Vivitrol, naltrexone. It comes in pill and in injection. So at Care Alliance, we have all this medication. We can do Vivitrol, and we can do the Suboxone or Sublocade. For pregnant women, we can do the Subutex. For pregnant women, these are special population. We can do the Subutex for them.
And that's great. And I think as you're getting treatment, as you're getting, care, people who are brave enough, who have enough courage to do it, I know sometimes, they experience relapse, right?
Yeah.
Can we talk a little bit about relapse, how they occur, and just other things that you think are important for us to understand about relapses?
Yes. Thank you, Mike. Relapse is one of the treatments about substance use. As a provider, I know that eventually they're gonna relapse. It is part of the treatment.
That is so interesting.
Yes, it is part of the treatment. We expect them to do that.
And I appreciate that so much. It just kind of, when you say that relapse is a part of it,
It's
man,
part of treatment.
I think that's huge because for me, I never, of course, I don't do this work, so I would have never thought that's a part of treatment. But I understand what it is, and I appreciate the level of empathy, the level of humility that you operate in to approach that because it really helps to disarm and again remove stigma.
Stigma. Yes, it helps to reduce the stigma because you're not judging them.
Yeah, yeah.
We're not judging you. It's okay. We're here for you. Tell me what happened.
I want to thank you though for sharing this context with us, sharing your heart with us. I think more than anything that I'm taking away from it is the level of empathy that you and care even that you approach this work with. And I think it's one of the things that makes Care Alliance what it is, people like yourself. And so I appreciate you. I want to thank you all for taking the time to join us for another Hump Day Health Talk. I hope you've enjoyed us this month through Mental Health Awareness Month, and we will see you next month during Men's Health Month.
Thank you.